All right, Easter is on. We're talking Easter candy. We're talking tooth and dental, all kinds of questions. Dr. Victoria Brotzman from High Point Smile Dentistry is here with us. All right, so you had said in the last time about not using a mouthwash with alcohol, and this person's asking, why is that not recommended?
So just because of recent studies, alcohol just can lead to more risk of oral cancer, just like any other alcohol that you're drinking over time. And so that's what the studies have shown. So that's why I don't recommend it.
Okay, this person says, I've got braces only on my top teeth. Why do I keep losing brackets?
So that could be so many different reasons why you're losing your brackets. Could be what you're eating, how your bite is. But when you do lose those brackets, or if they could become unbonded, go to your orthodontist or your dentist to get them back bonded, or otherwise your braces are not working.
Oh yeah, and you want those braces to work because you spent some money on that. Okay, this person's asking, are tongue scrapers worth it?
They can be for certain people. If you have, tongue debris, that white stuff on your tongue that builds up, I think tongue scrapers are worth it to use at night, once a day. They can be worth it, yes.
Okay. This person's saying, why do I have sensitivity on my back tooth while brushing with cold water or drinking anything cold?
That could be so many different reasons as well. I would start by using sensitive toothpaste. You might just have a sensitive tooth back there or recession. You may have other problems such as a cavity can cause sensitivity to cold. So I would go see a dentist, get an x-ray of that tooth, make sure nothing is going on.
Okay. This person's asking about their child wearing a mouth guard while playing sports. They're asking if that's okay if they do that.
Definitely. You can get a mouth guard either from your dentist, they can make you a mouth guard, or you can do the boil and bite mouth guards that you can get at the, Walmart or your local store. Definitely recommend, especially those contact sports.
Because, I mean, if they bite down, I mean, they could crack their teeth. They could.
Yes. I mean, someone comes at you playing football, people lose teeth. Baseballs, we see a lot. People, young adults losing their front teeth. So it just protects your teeth long term as an athlete.
Okay. This person's asking how often they should be seeing their dentist.
So you should go get a cleaning every 6 months, x-rays once a year. Unless something is going on, you can always go see your dentist in the meantime to, get a limited exam.
This person says, I've had pain in 2 cap teeth for the last couple of months, especially when eating cold foods. They had taken antibiotics for a possible sinus infection. Is there anything that's related to that, or what should they be doing now since they still have the pain?
So I would say go see whoever did those crowns. Make sure your bite is right and it's not your bite problem. Make sure that the crowns look okay, the nerves look okay. Get a couple x-rays to make sure nothing else is going on with the nerves. Make sure you don't need anything further than a crown.
Okay, and seeing if your bite is right is usually, don't they just like put that little paper in there and they make you kind of like grind around to see if it's touching in any points?
Yes, and when those crowns are high, it can really cause some pain and sensitivity. So I would make sure that's not the issue first, and then we can go from there.
Okay, yeah, that's the easiest way to find out. All right, this person's asking, can they keep their wisdom teeth if their wisdom teeth don't hurt?
It really depends on age and what the wisdom teeth look like. A lot of times we'd like to get the wisdom teeth out earlier rather than later because it's easier for someone to heal, in their 20s getting their wisdom teeth out than it is later on down the road in their 30s, 40s, etc.
And do your wisdom teeth actually hurt, or is it just that they're moving your other teeth so that they're making your other teeth move and get crowded?
Because they're in the back of your mouth, we see a lot of times people have beautiful teeth, but those back wisdom teeth get decayed because it's so hard to clean, or that tissue surrounding your wisdom teeth, that tooth starts to poke through, and then that tissue gets really irritated from food debris, bacteria in between the gum and the tooth. And so a lot of times that can cause a lot of pain.
All right, we've got about a minute left. We're all going to eat our Easter candy. We're just going to do it. So with that said, what should we be doing to make sure that we're taking care of our teeth as well?
Like I said, collect all your candy, eat it one time a day, don't snack throughout the day. And the biggest thing is no sugary drinks. I mean, that is the biggest cause that we see of tooth decay, rapid tooth decay. And if you do, drink it one time, one and done, water after, and brushing twice a day with nothing after no food or drink after you brush your teeth.
Okay, that's going to help a lot of parents when they say, you know what, the dentist said you couldn't have that glass of water or that milk before you go to bed. Thank you so much for your time and your expertise. We appreciate that. If you have anything that you're like, oh, you know what, my family member needs to know what that dentist just said, it's going to be in the 2 Wants to Know section of our website.